and welcome to the official YouTube channel of Lema Dental Clinic in Istanbul, Turkey. If you've been told you need a root canal infection removal, or you have experienced pain and wondering what the treatment involves, you're in the right place. In today's video, we're providing you with a complete guide to the root canal infection removal, everything you need to know about the procedure, recovery, and how it helps restore your dental health. Now let's go and see what is a root canal infection. Let's start by understanding what a root canal infection is. A root canal infection occurs when the pulp or soft tissue inside your tooth becomes infected. This is typically caused by untreated tooth decay, cracks, or trauma to the tooth, allowing bacteria to enter and infect the pulp. The infection can cause pain, swelling, and even the formation of an abscess. If left untreated, it can lead to more severe complications such as tooth loss. It's important to address it as soon as possible. Now let's go and see what the symptoms of a root canal infection are. How can you tell if you have a root canal infection? Well, some common symptoms include severe tooth pain, especially when chewing or pressing on the tooth. Sensitivity to hot or cold, even after the temperature is removed. Swelling around the tooth or the gums, which may be painful. Discoloration of the tooth, which may darken due to the infection. Persistent bad breath or an unpleasant taste in the mouth. Now, if you're experiencing any of these symptoms, it's crucial to visit your dentist right away for diagnosis and treatment. The root canal infection removal process. Now let's walk you through the process of removing a root canal infection. Root canal treatment is designed to remove the infected tissue and preserve your natural tooth. Here's what happens during the procedure. First step is diagnosis. Your dentist will first examine your tooth and may take x-rays to understand the extent of the infection. Step 2 is the local anesthesia. The area around the infected tooth is numbed with local anesthesia, ensuring you feel no pain during the procedure. Accessing the infection. The dentist will make a small opening in the top of the tooth to access the pulp and remove the infected tissue. Step 4. Cleaning and disinfection. Once the infected pulp is removed, the tooth interior is cleaned and disinfected to ensure all bacteria are eradicated. Step 5. Sealing the tooth. After the tooth is cleaned, it's filled with a biocompatible material called gutta percha. This helps seal the tooth and prevent further infections. Step 6. Final restoration. After the root canal, your dentist will place a filling or a crown on the tooth to restore its strength and function. This is important to protect your tooth and ensure it can withstand normal chewing pressure. Now let's talk about the recovery and aftercare. After your root canal infection removal, you may experience some mild discomfort or swelling for a few days, which is normal. Your dentist will recommend over-the-counter pain medication to manage any pain, and you may be prescribed antibiotics if there is a lingering infection. It's important to avoid chewing on the treated tooth until it's fully restored with a crown or filling. You'll also want to maintain good oral hygiene and attend follow-up appointments to ensure the tooth is healing properly. Part 5. Why root canal treatment is essential. You might be wondering, why not just remove the tooth entirely? The answer is that saving your natural tooth is always the best option. A root canal infection removal allows you to keep your tooth, preserving its function and your overall oral health. Losing a tooth can affect your bite, jaw alignment, and appearance. So preserving the tooth with a root canal treatment is the best long-term solution. So now you have a complete guide to root canal infection removal. If you're experiencing any of the symptoms we have discussed, don't hesitate to contact us for a consultation. We're here to help you manage your root canal treatment and ensure your teeth remain healthy and functional. If you found this video helpful, please like, subscribe, and leave any comments or questions in the comment section below. Thank you for watching, and we look forward to seeing you here at Lema Dental Clinic.